I'm going to guess the answer to this question, but are there any opportunities, or would you be looking sort of within surgical pathways to make changes that might have a positive impact on efficiency, for want of a better word?
Yeah, so I mean, that's one of the things that I've been particularly interested in over my 3 years as divisional director. How can we make elective surgery more efficient and best practice? And of course, if we had the perfect real estate, if we had the perfect hospital, it would be a lot easier. We don't. We have quite an old estate, and so there is the limit, and that elective work is not protected from the emergency work that we have to do, which I've just been talking about, and that is one of the restrictions and prevents the efficiency that I would like to see. But it's very much something that we're interested in, making sure patients are at their peak fitness before their surgery, the prehabilitation as we call it. Then they come in, have enhanced recovery protocols during their recovery from surgery, as well as minimally invasive and robotic type procedures, which we're keen on. And then post-op, there's the post-rehabilitation, trying to get patients fit again as quickly as possible and reducing readmissions. So those are all things that I've got a real passion about, that we're really interested in, to try and make sure those patients are treated in the most efficient way for them, but also in the most efficient way for the hospital and for taxpayers' money.
Yeah, okay. You talked there about prehabilitation. Are you doing anything with the wider system? Obviously, we're on a road to integration in the NHS. Are you doing anything with the wider system to help reduce the need for surgery in the first place?
So yeah, absolutely. We have one of the largest specialties that I deal with is orthopedic surgery patients with hip and knee conditions, often arthritis, often requiring hip and knee replacement. But we know that if they see physios along the journey, then that can give them a good quality of life for a period of time before they absolutely need their joint replaced. So we have community hubs where patients are referred up for for their knee pain, and then they're seen by physios, and they have a prehabilitation program to try and get them avoiding surgery, ideally. But if they can't avoid surgery, then at least get them as fit as they can before their operation. So that's really important, and we're working across the integrated care service in the whole of Nottinghamshire to make sure we do as much of that as possible, delivering care close to the patient's home where that's possible.